about health but didn't know where to go, a safe space for you where you could be able to express yourself, call in and actually have your questions answered in real time by an expert. This is NTV Medical Matters, and this is what we are here for. We talk about everything health, we talk about diseases, we talk about any infections, pandemics, epidemics, and so much more. All the questions that you have in your mind, this is a place where you are supposed to bring them. And we always open phone calls. We have phone calls, and we also have our social media, and you can always talk to us in real time. This is why we have NTV Medical Matters. So you're welcome, and we are really, really always honored to have you every Monday at 10 a.m. If you haven't watched, this is your time, and make sure that you can always join us every week. NTV Medical Matters is supported by Bill and Melinda Gates Foundation. Today we are going to be talking about cardiovascular disease, especially rheumatic heart disease. What is it? Why is it such a big concern in Uganda, and what should we do? Our expert is already in studio. I am Viola Sasya. A very good morning to you, and once again, you are welcome.
My name is John King Orio.
My name is Dichiru Keti.
Dichiru Keti is my wife. We're a couple, and we call ourselves rheumatic couples. Why? Because both of us have rheumatic heart disease. Keti was first discovered with the heart disease, rheumatic heart disease. At that time, we were just raw about rheumatic heart disease. We didn't know what it was, but they warned us that she needs to undertake heart surgery. And at that time, the Uganda Heart Institute was not doing those surgeries. They were not capacitated enough. So what they told us is likely she could be taken to India, but of course it was so costly. They gave her only 2 months, that if within that 2 months, if she is not treated, she could easily lose her life.
Thank you so much for that background information, John. So let me now switch to Madam Kate. I just want to understand, how were you feeling before the surgery as preparations were ongoing, and also what treatments were you receiving at the Heart Institute?
Yeah, I was receiving injection, and then there's a tab which you used to give me for protecting my heart, so that I can take some time to go for surgery. I was so bad, but I could not say anything. It's only that I was just on that medication. Yeah.
In fact, Kate was so badly off, because when I took her home, even at the time when I would take her to Uganda Heart Institute, she needed to be supported.
We've talked a lot about her and her condition, but I understand both of you as a couple have suffered from this disease. Where did you enter the picture? When was the first time you discovered that you have this same rheumatic heart disease?
They discovered me with the disease I think it was in March 2008. I started feeling feverish. The doctor treated me on malaria. And when the malaria was not, I was not improving. When I went back, he said maybe it could be ulcers. And he gave me treatment for ulcers. Still, I could not. So when I took the treatment for ulcers, when I was taking it, in the second day, that's when I got a heart attack. I blanked out. When I got to Mulago Hospital, I was put in casualty. Then from casualty, the doctor referred me to Uganda Heart Institute. He suspected it could be something to do with heart condition. Indeed, when we went for the test in Uganda Heart Institute, I was discovered with the same rheumatic heart disease. Lucky enough, at that time, she was not with me. If she was with me, I don't know what the story would be like, because I was the one who was taking care of her, financing her everything. So having that disease would mean something else to her.
And back to you, Madam Kate, how were you feeling right before going for surgery? How did this disease manifest in your body? What are some of these signs and symptoms you felt? But also, just to connect with it after the surgery, how did you feel? What kind of relief did you feel in your body?
Okay, from that time, I was not feeling well. I was so sickly. I could not carry even a 5-liter jerrycan. I could not even walk, even climbing the hill when I'm moving. I could not play, because if I would do any other work, that's when I would feel tiredness, when you are doing your work. So when after the surgery, after they have done the surgery, I came back when I was okay. After that, pain went, And also, although I'm on medication, but still I'm not so bad. But before, I was not okay. Yeah, when it was when we were in Dubai plane, when we were trying to walk, I could not even carry my bag. There are some people who have helped me to do it, to carry for me. If I reach, I just step 2, 3, I felt fainted. That's why even my friend, the one who died, that's how she was. Even sitting in the airplane, eating food was difficult for us to eat. It was not easy.
Okay, so John, talk to me about now South Korea. How do we eventually land in South Korea? What was the process? What did it entail? And what was it like when you eventually got to South Korea, when Madam Kate got there?
I was everywhere looking for help. I even tried to visit my friends, one of my best friends in town, thinking that they could help me. We started raising funds. The money was not coming. Nobody could be able to give us the money that would go. So I was even on the net looking for sponsors. I even applied to Larry King Heart Foundation in the US. I didn't receive a positive answer. So but I didn't give up. I kept on looking for it until I came to land on this gentleman, Mr. Kim, Wansang Kim. He's a Korean, and in fact, I was just reading the newspapers when I got to know that he was sponsoring people, heart patients, to go to India. I mean, to South Korea for treatment. Then I'm like, why can't I try this? We had to undergo tests to win the sponsorship. Indeed, both of us were called. We went to Uganda Heart Institute. When we did the tests, in fact, she failed the test. Instead, I was taken. Then I told Mr. Kim, no, I cannot. I cannot go because I can't leave her. If I fly, I know she will die. I will not take that opportunity. I will not take the sponsorship. Both of us, we just have to stay. And that is it. After 6 months, that's when the doctors accepted. They said, okay, what we are going to do, we can take her, but on condition that she reaches there safely. We never knew anything can happen in the flight because of her condition. By the time she even flew, her condition had deteriorated further because, you know, it was 6 months after. The results delayed to come, yes. But God willing, she was flown to South Korea. In fact, the story continues. When she came back, what the Korean team did was, after 6 months, they came back to check on their condition. So when they came back, they called her to Uganda Heart Institute because that's where they were based. And when she got there, they saw her alone. I think they were expecting her with me. When they saw her alone, the first question they asked her was, where is your husband? She's like, he's at home, he's not feeling well, he's bedridden. So he was not able to come with me. The doctor said, no, that cannot happen. Before then she could be given a seat to sit, they said, can we go back to see him? And that was the story. They drove her to our home. In fact, they entered to our bedroom. And where they told her, please prepare him. We are going to take him back. We are going to take him to the hospital. We want him treated. He's the reason why we have come. Because there are things that he has done that we have not seen and other people could not do. He stepped in for your life. It is the one reason why we have come. Yes. And we want to go with him. And I was taken to the hospital, admitted. And lucky enough, it was this very gentleman, Mr. Kim, who paid the hospital bill. Because when I got there, I was taken straight to intensive care unit. You know how expensive it is. So he paid all the hospital bills. But before the team could leave to go back to South Korea, they said, we have prepared for your surgery. We have come and we've left every instruction with Mr. Kim, and he's going to help you to fly back. So that's how I got my surgery in 2010, 2 years after she was operated.
A very touching story from Mr. King and his wife Kate, and they have suffered from rheumatic heart disease, but they were very lucky to have surgery, but not very many people are lucky to actually have it. So it's why we are here today to understand it, and it's NTV Medical Matters, supported by Bill and Melinda Gates Foundation. I am Viola Sassia. Once again, you are welcome. Stay with us for the entire hour because we have an expert in studio with us, and that is Sister Samali M. Chitoleko. She is a critical care nurse at the Uganda Heart Institute. Thank you so much for coming through, Sister.
Thank you, Viola, and thank you for listeners for tuning in.
We're going to start off with the pressing question, and that is, what is rheumatic heart disease?
Hello, viewers. So rheumatic heart disease is a condition that is caused by permanent damage to the heart valves. People may be asking, what are the valves? So our heart has 4 chambers in it and different parts. It has blood vessels, valves, the walls, so many parts. But the part which is affected by rheumatic heart disease are the valves, which act like doorways. As any door we have in the house, it means it can open to allow blood flow across, then closes so that blood doesn't flow in the opposite direction. But now in rheumatic heart disease, it means that that part of the heart is permanently damaged. And when it is permanently damaged, it can either fail to open properly, or it can open but fail to close. And that can be in one or more of the 4 valves we have. So that's what rheumatic heart disease, and it's an acquired heart disease, meaning that people are not born with it. They just get it along the way in the journey of life.
Okay, so yes. How is rheumatic heart disease connected to cardiovascular disease?
So rheumatic heart disease is one of those biggest cardiovascular diseases which is acquired. We have cardiovascular diseases which are congenital, meaning children are born with it, but rheumatic heart disease follows under the category of acquired heart diseases which people get along the way of life. And it's a very big concern because we have so many patients who are affected with it, and many of them are bedridden, many of them need surgery, so it's a very big problem under the main umbrella of cardiovascular diseases.
Okay,
yes. You
mentioned that it's not something someone is born with, so what really causes them? And interestingly, this couple had it at the same time.
Incidentally, that couple didn't have it at the same time, as we are going to see. So rheumatic heart disease is caused by a bacteria, which is called a group A streptococcus. When it enters into one's body, it settles in the throat, and then you get a bacterial sore throat infection, which any of us has ever gotten. I've ever had it when I was growing. So if it is not treated appropriately, meaning with the right type of antibiotics, and for the recommended period of time, the pain will disappear, but the bacteria is still there in the body, unfortunately. After about 1 month, the person's body, the immune system, will produce antibodies, which are like soldiers, which is a normal thing. Those soldiers are supposed to be attacking the bacteria. But unfortunately, in some group of people, instead of those antibodies attacking the bacteria, they attack different parts of that person's body. They can attack the brain, the heart, the joints, and the skin. But the good thing is that with the brain, the joints, and the skin, the damage is not permanent. But to the side of the valves of the heart, the damage they get is permanent. And that's when rheumatic heart disease comes in.
So once someone has rheumatic heart disease, what are some of the signs and symptoms to look out for, especially if you just want to make sure that you go ahead of it and find treatment before it's too bad?
Right. So with the signs and symptoms, many people, let me first begin with this, that many people are working with this disease and they don't know. And many times it is showing some tiny signs and symptoms, but people are ignoring. But commonly, people would start with getting, okay, they must have a history of having had a sore throat infection in their life. That's one.
Okay.
Then after that sore throat infection, they must have had a fever in their life, and many times that fever is associated with the joint pains. But many times they treat malaria. So they have that kind of history in their life. Then as the symptoms begin, someone starts getting tired easily. Yes. They do something small and they feel tired. If it is children going to school, they can't reach without resting. Sometimes they even fail to reach completely. Others are caned by the teachers because they've gotten school late, simply because they can't catch up with their colleagues. They walk slowly. So after that, they start coughing. Coughing is a common symptom, and this coughing is not responding to common antibiotics used as usual. Then they start feeling the heart pounding. Yeah. Naturally, we are not supposed to be conscious of our heart beating. It's an inner thing. But people will start feeling their heart is racing, beating very fast. And sometimes when they touch this side of the heart, they feel like something is pounding. Then gradually, their body starts to swell, especially the legs swell, the abdomen swell. They become sick, real sick, but that's how the flow of events is.
So Sister Samali, as you speak, I'm thinking about conditions like, or diseases like TB, tuberculosis. Some of those things also express themselves in a similar manner. So how do you differentiate between them, especially at the time of the checkup?
All right, thank you very much. So on the time of checkup, naturally when a patient comes to hospital, we don't just run for tests, echo or x-ray, we first examine the patient. Okay. So during the examination, when we use a stethoscope, that is the small instrument doctors use by putting in the ears and listen to the heart, they will feel some funny heartbeats. Because we know how a normal heart is supposed to beat, but when we use that machine, a stethoscope, and we hear some, we call them murmurs, some abnormal heartbeats, we are able to tell that, oh, this one is most likely a heart disease. If it was other condition like TB, you definitely hear funny sounds in the lungs. Then you know it's the lungs and TB. But for the heart, when you listen to the heart, because all parts are located in the chest, you will specifically hear some abnormal heart sounds. Then you send the patient for respective heart tests, as we are going to see. Okay,
so talk more about the throat infection. Where does that come from in our environment that maybe we could have a chance of avoiding it?
So this bacteria we are talking about is freely moving in our environment, in the air. It is microscopic. We can't see it with our eyes, otherwise people would be dodging it. But it can't be seen. It is freely moving and can easily be spread from one person to another. Through the air we breathe, through direct contact, maybe a child has bitten on a mango and given another one to bite, things like that. So it can easily be spread easily, very contagious, can easily be spread from one person to another.
Okay, so let's look at the opening and the closing of the valves. How important is that? I just need you to explain a little bit more for our audience. What is the most critical role of the valves, and when they close or can't close, what exactly is happening?
All right, so in the heart, like I said, there are 4 chambers and 4 heart valves. 2 of them work at the same time. Like on the left side, on the right side, when blood without oxygen is entering back into the heart, the side on the right side of the heart called the tricuspid valve is supposed to open and blood flows across into the lower chamber. Then it will close so that that blood doesn't flow back, but instead takes on the left side to go to the lungs to be oxygenated. Then flows back to the left side of the heart. The valve will open up called the mitral valve. The blood flows into the left ventricle. Then that valve will close because it is one way, allows only blood to flow across. Then it will close so that that blood doesn't flow back into the lungs, but goes on to be supplied to the rest of the body through the aorta. So God made our heart in a way that blood will not understand. If you have 2 openings, blood is not wise enough to understand that let me go to the left or to the right. So that's how God made it in a way that one side will close and you'll be left with one, which is open, so the blood will take the direction. So that's how it is that when blood flows across, that valve closes so that it doesn't flow back. Now in rheumatic heart disease, when the valves are affected, they become thick and stiff. And let me get this one clear, that it is not the bacteria which attacks the valves. No. It is the antibodies produced in the body which are supposed to be fighting the bacteria that attack the valve. So when the valve is attacked, it gets inflamed, or we can say it gets wounds. Then when those wounds heal, they leave scars on the valve. When the valve forms scars, incidentally calcium, this iron which is supposed to make our bones and teeth strong, goes and deposits in the scar. Then the scar will become, the valve will become thick and stiff.
What?
When it becomes thick and stiff, that's when it fails to either open or to close. And when the valve fails to open or fails to close, it disorganizes the way the heart works.
Yes.
It gets confused, the heart starts working harder than it would have been, and then gradually the heart becomes big, becomes weak, and that's when people start presenting with the symptoms.
Why do the antibodies fight the valve?
Now, that one is a very technical thing. We call it molecular mimicry. It's kind of technical, but it happens in just a few people, about 3 to 6% of the population, where they get what we call inappropriate immune response.
Okay.
Instead of the antibodies produced attacking the bacteria, they instead attack the host cells.
Oh.
Yes, right. And it is also genetically predisposed. Some genes are responsible for that.
Okay, what are some of the tests for rheumatic heart disease? And after that, is there any medication you can get immediately to reverse it?
All right, now before we jump into rheumatic heart disease, there is the sore throat, there is rheumatic fever and rheumatic heart disease. I would beg to begin from there. So when somebody has a sore throat infection, how do they know that it's dangerous? This particular sore throat infection, which is caused by this bacteria, the group A beta hemolytic, will happen so suddenly. Out of the blue, you start feeling pain in your throat. It pains when you are swallowing, and then you start feeling swellings under your cheekbones here. They are tiny, maybe like a bean seed. They are in here, swollen and painful. There is no cough, there is no flu. So that's when we know that somebody has gotten this sore throat infection as a result of this bacteria. And at that level, if they go to healthcare workers, they can be treated promptly. They are given penicillin antibiotics for at least a week, and it will be cured completely. Okay. The problem we have is that many people at that level, they treat themselves with the herbs, with some antibiotics which are not penicillin antibiotics. They take it for 2-3 days, the pain disappears, they stop it before the infection is eradicated. Now we move on to rheumatic fever. Rheumatic fever is that stage where the body is trying to fight the bacteria, but instead attack its own self. Okay. That's the period we call a period of acute rheumatic fever. Now, a person with acute rheumatic fever will present like any other fever, because fever is just a warning that your body has been attacked. You have a headache, joint pains, you feel hot, shivering, joint pains, nausea, vomiting. That is what we call fever. And it's the duty of healthcare professionals to investigate which type of fever. Unfortunately, many times in rheumatic fever, people are not investigated and they are not treated. When a child has fever, the parent will run for a remaining dose of Coartem. 4 tablets which remained from the previous dose, they are given and they think that's it. So that fever, it's not diagnosed and it's not treated, so that's how we end up with RHD. But if people come to us, we can easily diagnose that fever, we can easily treat it so that people don't develop rheumatic heart disease. So if we miss them at that stage still, and they come at the stage of rheumatic heart disease, unfortunately, there is already permanent damage to the heart. But it's not the end of the world. It doesn't mean a death sentence. We can still treat them, but at that stage, we just manage the disease.
Okay, I like the fact that you mentioned that there is hope, but you won't be cured. You just have to manage it, which is why we have to run as soon as we feel pain around our throat area. Exactly. So if you're just joining, it's NTV Medical Matters. We shall be running for a quick break. When we return, we shall look at what are some of the available treatments for rheumatic heart disease and understanding it further. For now, let's go. We shall be back shortly. Let's quickly talk about your daughter, Princess. How did she come in the picture? I understand there was a concern about conceiving or giving birth in that condition where Madam Kate was always weak body-wise. So at what time did this princess enter the picture, and what was the process like? I'll start with her.
child was after the surgery. Yeah, I was strong enough. It was only that my legs were only swelling, but I didn't even feel sick when I got that pregnancy. Yeah, I didn't feel sick like other women. You vomit, you do what, but for me that was not there. It was only my legs which were swelling, but I used to go to see my doctor every month. Yeah.
This is my lovely princess, Esther Letaro Miracle. She came after troublesome period that we have because of our rheumatic heart condition. The doctors, they predicted doom, but here we are. God has blessed us with her, and such a lovely girl, so friendly, and we love her. She's the apple of our eye.
How has your life and your family's life changed after receiving these gifts of surgery?
After the surgery, they went in the intensive care unit. When they woke me up, you know, my body was paining like nothing. And the whole of my body was shaking like a leaf. And the whole body, my systems were not cooperating. It's like I've lost a battle. That is after the surgery, waking me up in the intensive care unit. I'm like, will I survive this? But 2-3 days, I was taken off from the intensive care unit, meaning that I was improving. And indeed, my rate of development, my body recovery was very fast. The doctors themselves, they even said, your recovery is so quick. I don't know what is it. But the whole thing is about my mind, my mindset. It was changed. I knew I was already treated and I would be better. Having learned from my wife after surgery and how she was behaving, she was doing very well. I'm like, that means I will be like her, which I'll be able to team up together and to recover whatever we've lost during the time of our disease. But still, after the training, when I flew back to Uganda here, and indeed life had changed for us, and we made sure we tried to do get back our businesses that we had already lost.
I love the fact that your family is coming back to life, sort of like a plant regrowing after being cut down. We thank God so much for that. So let's now talk about your last messages to Ugandans, to everybody who might be experiencing this disease.
You felt sick anywhere, you have a sickness, which can, or you have a headache or chest pain, and then chest pain, and then also ulcers inside. That thing can do what? It can affect you. It can affect your heart. So you have to go and see doctor. Even if you have malaria, even if you have to go for checkup. But you see some other ladies, for them they just collapse, not knowing that they have any disease. But at least if you go to see doctor every month, you check how your health is. That's when you can do what? You can know that this is sickness, I have it, or this one I don't have it. I'm just appealing women who are out there, and also the children. You have to look after your children. There are kids who fell sick, but you don't know how he felt sick. That one can even affect their heart or whatever. In Mulago Heart Institute, there are so many children who are sick. That is not good. So I'm just appealing people from there, check on your health, and also eating. You have to eat well.
To the rest of the heart patients, I want to say, you already know the story, that you must be able to take your drugs every day, the way the doctor has prescribed it, and never fail to take your drug. Secondly, when it's time for your review, endeavor to see your doctor whenever it's time for you to see your doctor. Then thirdly, watch on your lifestyle. If you have been living a free lifestyle, please, you must always continue. And you must make sure that you change. One, about food, you must eat a balanced diet. And don't eat food that has a lot of fats. And watch on the sugar you take. The intake, this processed sugar is not okay. But there are many other ways you can have sugar intake. Like in sugarcane, in fruits, you can have those. And if you are to take this processed sugar, make sure you take it very little. In a tea, maybe 1 teaspoon of sugar in whatever you are going to take.
Mr. King and his wife Kate live with the condition of rheumatic heart disease, but they've been able to live to tell the tale after being able to get surgeries from South Korea thanks to a good Samaritan. But not a lot of people have the chance to actually, get the surgery or get treated. So we shall be talking about available options. We'll come back from the break. I'm still here with Sister Samali, and she works at the Uganda Heart Institute. So Sister Samali, let's talk about the availability of treatment. What are the options, and at what stage can they be effective?
Thank you, Viola. So the treatment for rheumatic heart disease depends at the stage at which we've gotten someone. If the disease, because the disease can be either mild, moderate, or severe. If the disease is mild, they have few symptoms, and basically what we need is to prevent further damage to the heart valves. And we do that by preventing the attacks of rheumatic fever, that fever I talked about, that is due to untreated sore throat infection. And we prevent that fever with an injection of benzathine penicillin, which we give for a long period of time, not less than 5 years, if not for life, so that a person doesn't get any further attacks of that fever to prevent progress of the disease. If somebody is at a mild stage, they start having symptoms, there is medical therapy, which involves medication to relieve their symptoms. If they are having chest pains, palpitations, body swelling, we give them medications to relieve the symptoms, but not to treat the affected valve. Those who have a full-blown disease, meaning severe disease, of course, they will need the medical therapy to manage their symptoms, to prevent complications, and to prevent further damage to the heart, but they also need surgery. Surgery involves repairing the valve if it is still repairable, or replacing it. If it is badly affected, it may need to be replaced, meaning an open heart surgery where the valve is removed completely and replaced with another valve.
I've seen pictures of the open heart surgery for both Kate and King. Mm-hmm. Talking about the valve, I really want to understand what happens with the surgery, especially for the woman. She mentions that she was at a risk of not having a child if she had had that extreme surgery. So they repaired. What is the difference between the complete surgery and the repair?
So in repair, it means that part of the valve is still okay and part is working, is affected. So the affected part can be repaired without involving removal of the whole valve. That surgery is normally preferred for young children who probably may not adhere to the do's and don'ts of the after surgery, but also for young women because it allows them to have a child, 1 or 2, without a lot of hassle, like it happens during when surgery is done. So that's how probably they did a repair for her. But when a repair is done, we continuously monitor this patient because at one point in life, they may need a replacement.
That's after the repair?
After the repair, yes. They may need a valve replacement, but we keep a close eye on them.
Okay.
Yeah.
What happens with the replacement?
So with the replacement, of course, like I said, it's open heart surgery. Somebody is taken in theater. They split their chest to be able to reach the heart. The heart is put to rest, and then they are put on a machine which is helping the heart and lungs to work. It's called a heart-lung machine. Okay. Then the surgeon will get into the heart, cut out the diseased valve, 1 or 2, and then replace it with another valve. Now the valve we replace can either be a tissue valve, meaning it is made in the factory, but it's almost like our normal tissues, or it can be mechanical. It's a metal one, yes. But if we put a tissue valve at one point in life, somebody will need again a replacement. But if we put a mechanical one, it will serve for 20, 30 years without needing to replace.
What are the do's and don'ts after you receive, say, mechanical?
So after mechanical valve surgery is done, these people will take medications to prevent blood from clotting on these valves, because it's a metal seated in somebody's heart for the rest of their life. It's not like our normal tissues, meaning that when blood is flowing across that valve, it can form a clot, and a clot can destroy that valve. So we give them medications to thin their blood. They are called blood thinners, so that their blood is thin and not easily forming clots on that valve. That medication is a bit strict. It is taken at the same time every day, without skipping, without forgetting. And then it comes with some dietary restrictions. There are certain foods which don't get along with that drug. We tell them to eat them with caution, or sometimes to avoid them completely, sometimes. Yes. And then they are supposed to be coming to the hospital every month, so that their blood is drawn and we check how thin or thin their blood is. Because if we don't do that, blood can remain very thick and destroy the valve, or it can become very thin and they bleed. So we have to check to keep a balance of the thickness and thinness. And then when it comes to games, like young children, there are certain games we restrict, like contact sports. Sports which involve people knocking one another, because they can easily knock them and they bleed internally. And then when it comes to women, women of childbearing years, it's a bit tricky to have children when you have a mechanical valve. I would say it's possible, but it is risky, and it is done under guidance of a gynecologist and a cardiologist. It's not that somebody would just wake up and say, oh, I need a child, let me get pregnant. No. They're normally supposed to have preconceptual counseling, during which time we assess the risks and benefits, and then we see whether it will be possible. So,
Sister Samali, on the repaired valve, what medication accompanies the post-surgery, but also does it have any impact on improving the person's valves, and at what stage would they be needing another surgery?
Thank you, Viola. Once surgery is done, the biggest aim is to improve somebody's quality of life, so that they can grow up near to normal life. Near to normal, because they will have some few limitations. They'll be feeling fine. If it's a child, they normally continue with their school, graduate, get a job, and work like any other person. But they have a few limitations, because they'll be taking medications, and they will continue coming to hospital for checkups, and that is for as long as they live. That's why I say near to normal. But generally, the life improves, and somebody is able to grow up. If it's a mother or a parent, to take care of their children and plan for them. Regarding treatment, that injection, monthly injection that prevents further damage to the heart, unfortunately has to stay for the rest of their lives. Because if we do not protect them from that fever, rheumatic fever, it can come again and affect the other valves. Okay? So, and some few tablets may remain, because by the time surgery is done, the heart has undergone certain changes, like it has become big, it is not beating well, and those will need some medications to control them. So they'll continue with medications for the rest of their life, but the good thing, the quality of life improves. That's the most important thing.
What stage again do you have to have another surgery?
Now that depends on each individual, and for that reason we keep a close eye on them. When we do the surgery, it doesn't mean that we set you free and you go in the world without coming back to us. That's why I stress that regular clinic follow-ups are equally important, because during that time we are closely monitoring that heart and the valve which was repaired or replaced. We are monitoring their symptoms, and if we see anything has gone out of hand, we go back and do the echo. If we see that the heart is not well, then we can recommend. So that time depends on each individual.
You know, I've been making calculations inside my mind, like how possible is it for someone to access all this in Uganda, and the possibility of surgery? Do you see it as something possible?
Yes, it's very possible. Right from the sore throat infection, If you go to the health care professionals and you have your child or you has a sore throat infection, the antibiotics they will prescribe are readily available in Uganda, penicillin antibiotics for that matter, for 1 week, and you'll be done with it. If you go at the stage of rheumatic fever, the tests, laboratory tests to investigate that fever, the ASOT test is readily available in Uganda. The antibiotics you'll need are readily available. So we give critical antibiotics for at least 10 days, but then continue with that injection for a period of not less than 5 years. It depends. Then at the stage of rheumatic heart disease, severe disease that requires surgery, or I didn't mention, we have also a treatment option called balloon valvuloplasty, where if the valve doesn't open properly, we have a way of opening it up without doing a major surgery. It's called a procedure where we just try to make it open to allow blood flow across. If it needs surgery, repair, or replacement, it is readily available in Uganda at Uganda Heart Institute. Yes, we do the surgeries very well.
Okay, so at what point does a sore throat become very concerning, especially now that we get a sore throat from maybe cough or flu, whatever? So at what stage should someone run? Because I feel like the available option for us now is to make sure that we are ahead of time.
Exactly. So sore throats are a common thing, and I should say that not all of them are caused by bacteria. Some of them are viral, and they are self-limiting. They don't need a lot of treatment. You just support the body with drinking a lot, resting, and sorts of things. But this one particularly caused by a group A beta hemolytic streptococcus. When one has a sore throat and they go to the health care professionals and they examine the throat, they should be able to differentiate whether it is viral or bacterial. And if it's bacterial, they select the best penicillin antibiotic for you. Yes.
So the key is
so I'm trying to avoid, I don't want people to get me wrong that each time I feel sore in my throat, I should go for an antibiotic. No. Many of those sore throat infections are viral. And like I said, the one which is bacterial doesn't cause a flu, doesn't cause a cough. It just comes suddenly. You get pain in your throat, especially on swallowing, and it causes swelling of these lymph nodes here. But normally there is no flu, there is no cough.
Okay.
Yes.
So the key is to run to a healthcare provider.
The key is to run to the healthcare professionals. Don't treat yourself because they know the best antibiotic to give. And after checking there, they can also do a throat swab. They can swab down there, go to the laboratory and check which bacteria exactly it is. So all those are available in Uganda. The important thing is to run to the healthcare professional when you get a sore throat, especially children. Children between the ages of 5 and 15 years, this is where this bacteria is very common. That's where we should be very, very careful. Yes.
And so let's talk about prevention. You said it's common amongst those children. Where do they get it from and how can it be avoided?
All right, so it is common in children between those ages. They are normally school-going children. And like I said, the nature of this bacteria is that it can easily spread from one child to another. So one child infects the other through these common things like poor coughing etiquette. Somebody coughs in the air without doing the common thing we do like this without using a handkerchief, so they easily spread the bacteria around to others. Schools, especially where there is a lot of overcrowding, this bacteria is very common. Where our classrooms have a big number of children, the classes are not well ventilated, the floors are full of dust, this kind of bacteria spreads quite often or very freely in such environments. Even in our homes, where we have homes which are accommodating a very big number of children, I mean overcrowdings, it can be at the level of the house, where the house is accommodating a big number of people. Then you go to room level, where the room is accommodating, especially at night when we are sleeping, a big number of children or people. Then you go to bed level. There are families where more than one child sleeps in the bed. So all that is overcrowding, whereby one person, if they have it, they easily spread it to another person.
Sister
Yes.
Samali, you've been at the Uganda Heart Institute. What is the prevalence of the rheumatic heart disease, and how does lifestyle influence its occurrence?
Okay, regarding the prevalence, the really recent data we have indicates that 1 out of every 100 school-going children, they have rheumatic heart disease. So the prevalence is quite high, and it is a very big health concern to the ministry and to the general public. And such children, many of them don't even know they have it. Because you can imagine somebody moving from mild, moderate, they are there, they are in school, they are praying, but they don't even know. Because commonly we've gone to such places to do screening, and we've been able to pick many of them. They have the disease, but they haven't had symptoms yet. And that particular age group, these are school-going children whom we expect to finish school, start working. Unfortunately, they get it at around that age, and it puts them down at the level where they are supposed to be productive to their families, to the country, and then the disease puts them down. The families use a lot of resources to manage them. They need a lot of money to treat them, for the surgery, the aftercare. So you realize that it doesn't affect that person alone, the family at large and the country at large. And it is the biggest cause of cardiovascular death in children and young adults, according to our statistics at Uganda Heart Institute. So majority of the death happening due to acquired heart diseases between young children and adolescents, rheumatic heart disease is the leading cause.
Thank you for that. Is there any stage where the body is able to fight off the disease, especially if someone has a strong immunity, for example?
Yes, our bodies are made in a way that when bacteria, virus, or other invaders attack us, they produce antibodies, and they are able to effectively fight them off without sometimes even our knowledge. But some bacteria are so fun and strong that the body tries to fight when they are also fighting back. But in rheumatic heart disease and rheumatic fever, like I said, only 3 to 6% of the population will get inappropriate immune response, whereby instead of the antibodies attacking the bacteria, the antibodies attack the host cells. And then moving from there, those who have rheumatic, not everybody who has rheumatic heart disease can develop rheumatic, not everyone who develops rheumatic fever can develop rheumatic heart disease.
Yes.
At that stage, only 60% of those who get rheumatic fever will end up with rheumatic heart disease.
Okay, so
Yes.
Sister, we are going to be leaving this studio very soon, but I just wanted to spend the last few minutes shedding a little bit of light about heart disease in general. You've been at the Heart Institute, so what can you say about, what can you say about especially lifestyle? What's the influence on our hearts? What should we look out for and guard our hearts against?
All right, lifestyle, I'm sorry to take you back a bit. There is a question you asked about lifestyle and rheumatic heart disease. Now, rheumatic heart disease is not majorly a disease of lifestyle. Yes. For it is due to inappropriate immune response.
Okay.
Now, back to your question, lifestyle, like John King mentioned somewhere, poor feeding, which people call good feeding, is one of the biggest problems. When somebody eats chips and chicken, they call it good feeding, but to us it's poor feeding. Taking a lot of foods containing cholesterol, people are physically inactive, they spend the whole day seated down without burning the calories they've consumed. Poor health-seeking behavior is one big thing I should talk about. These diseases normally show warning signs to us, but we pay a blind eye to them.
Yeah.
Or people want to treat themselves. So poor health-seeking behavior is one of the biggest problems, where people want to treat themselves. Even when they treat themselves, they don't complete the treatment. Or when they come to us and we prescribe medications, they don't complete. So it's one of the biggest problems we are having around.
All right, thank you so much for those pointers, and I hope that our viewers were able to pick that up. This is Sister Chitoleko Samali M. She's from the Uganda Heart Institute. She is a critical care nurse. there at the Institute. It's really been a pleasure having you, and thank you so much for making time. Thank you, dear viewers. We have run out of our time, and you can catch us again next week for a different episode and about a different health concern. Thank you so much for watching, and have a lovely day.
Bye-bye.